SPI Pharma is the Global Arts Director, and I look forward to talking to you today about our product, Acetaminophen Acetaminophen Actimask 92M. Before I begin, I have a very high altitude, very broad discussion on why taste masking and strategies of taste masking, very brief. And I think when you look here, why taste mask, a picture's worth 1,000 words. It's very obvious that when you don't taste mask products, it can lead to patient compliance issues. Patients typically will not take bitter products, especially children, but even adults, typically if the product is bitter or doesn't taste good, refuse to take the product. And that's very important to oral dispersible tablets, oral dispersible powders, and other oral forms such as liquids and suspension. Dosage forms benefiting from taste masking, you can see chewable tablets, orally dispersible tablets, orally dispersible powders, syrups, suspensions, and effervescents. Now, with the liquid formulations, it's very difficult to control the taste masking because taste masking methodologies typically dissolve in the liquid or are not as effective. However, with the first three, the solid dosage forms, you can control to some extent taste masking. Now, when we talk about taste masking, what are we trying to taste mask? We're trying to taste mask specific functional groups, really. Obviously, a larger, broader discussion of taste and taste receptor approaches lends itself to stereochemistry and other such discussions. However, in a very, very high altitude overview, typically carboxylic acids impart acidic tastes, and amine groups impart bitter tastes. Now, acidic tastes are not as disruptive to the patient. We all eat citrus fruits, we all drink orange juice, we all drink grapefruit juice, and those are very acidic, and we tend to like them. However, the bitter taste of the amines is very, very destructive to the patient compliance. The human taste receptor does not tolerate amines very well. So especially heterocyclic amines are the most bitter and the least tolerated, and we all know how bitter caffeine can be. And caffeine is one good example of a heterocycle that has two amine groups in it. Taste masking strategies. Well, you can use a dispersive strategy where you deliver the active in an expanded volume or suspension or liquids or effervescent. This tends to lower the concentration of the active at the receptor site and reduce the taste. You can use a flavoring or adjuvant strategy, such as using flavors that complement the molecule. For example, an acidic taste might be complemented by a citrus fruit. You can use citric acid or tartaric acid to confuse the taste buds, or licorice or anise. People use these things. Neutralizing additives can also be used. Many flavor companies supply neutralizing additives. Typically, that strategy only works if the nocive capacity of the drug is not that great. Solubility reduction strategies, such as ion exchange resins or suspensions, tend to work. They lower the solubility. If the active is not soluble at the receptor, then of course it is not available to produce a taste. Barrier strategies such as complete coating or encapsulation, and granulations, which are incomplete coatings, where you granulate around it and hope to reduce the contact with the taste receptor. Well, that brings me to our product, Actimask 92M, Taste Mask Acetaminophen. We make a lot of orally dispersible platforms, Pharma Burst and Pharma Spurs for orally dispersible disintegrating tablets and orally dispersible powders. And so it's just a natural progression for us to move into taste masking actives because these types of systems require taste mask actives. Now, when you look at acetaminophen, you see the gentleman with the black hat, I'll say, is this group here. It's an amine group, and that is what is most likely causing your bitter taste with acetaminophen, and that is why acetaminophen needs to be taste masked. We wanted to make 80 and 160 milligram orally disintegrating tablets of acetaminophen, and for that reason we had to move into taste masking this product. Some of the attributes of our Actimask 92M system is that it has less than 15% release in the first minute. We use 1 minute time release in dissolutions in 900 mLs to gauge how much taste masking we have compared to the raw powder. It also exceeds the compendial target. This is very important. At 30 minutes, we have 100% release. Many taste mask systems, you have to watch out with taste masking. They can slow the release of your system, and you may not be in immediate release dosage form anymore. And at gastric pH, we match the uncoated API release. So once our taste mask product enters the stomach, it matches the uncoated API release. It's a hydrophilic coating. So that means no residual solvents, has a uniform smooth hydrogel coating, so it goes well organoleptically with orally disintegrating tablets, and it has a uniform particle size around 400 microns. Also extremely important, especially in a low potency drug such as acetaminophen, it has a 92% assay, which means you don't have to increase tablet weight greatly to incorporate the product. This is a picture of our taste mask acetaminophen. You can see the middle that we have the coat, and you can see, or I'm sorry, the core is the acetaminophen, and we have a very uniform coat between 2 to 3 microns thick that we've generated around, and this is a gelatin type coat. Some typical physical characteristics, and the only thing I really point to here is the angle of repose in the CARS index, which demonstrates very free flowing. It's very easy to use in the direct compression tableting process. It has a very uniform particle size, as you can see there, very limited fines. Also, you see there a microscope picture of it smashed down under a glass plate so we could take the picture. This is the first dissolution profile I'd like to discuss. It was done in 6.8 phosphate buffer, 900 mLs. Why did we choose 6.8 phosphate buffer? Because the pH of the mouth is 6.8 to 7.2. So we were really interested here at the 1 minute time point. How much release would we have compared to acetaminophen powder? And what we found quickly is we had about 14%, and the acetaminophen powder was at 52%. So we've cut down the amount of acetaminophen available to taste receptors by quite an amount at that first minute time point. Typically, ODT should disintegrate in 30 seconds or less, which means 1 minute is giving us a little extra time for residual to hang in the mouth. So we have a reduced release. If you look at a competitor we went up against, a solvent-based system, they also had a very low release at 1 minute. However, when we go to pH 5.8 phosphate buffer, which is the USP compendial media for an immediate release tablet, what we see very quickly is at 30 minutes, the USP requires this 80 plus 5%, or Q plus 5, or 85% be released in 30 minutes to be considered immediate release still. What you see very quickly is the competitor has 47.2, that's the red line, and we are the blue line at 100.4%. So we've released everything in 30 minutes. And that's very important, that you get your taste masking but maintain your release. Because the reason you're doing this in an ODT is so that the patient gets very rapid therapy, and that you want it to be, you want them to be compliant. So you're taste masking to stop the bitter taste, but you still want the therapy to be rapid. Whereas if you use a taste masking system such as the red line, now you're no longer compendially an immediate release type system. And then we did a study in acid. So the next environment after you swallow, of course, is the stomach. So 0.1 normal hydrochloric acid. We found very quickly that the Actimask, the blue, and the green, which is uncoated acetaminophen, released at the same rate, whereas the solvent-based competitor releases much slower. So this is an absorption site, and you want to get out fast here, especially if you want to control a fever or pain. So once again, very successful in the 0.1 normal HCl with regard to our release. Now the product is gelatin coated, has a 92 plus or minus 3% assay, pack size is 50 kg drums, and the shelf life is now, I believe it's been extended to a year now actually. The slide shows a little old. And all ingredients meet USP, NF, and or EP. So it's relatively easy to register. We studied our product in its drums, the 50 kg drum, with regard to accelerated stability. And what we found is if you look at the assay, it doesn't change over 6 months. You see a group of associated impurities that you are required to track for acetaminophen. None of them ever rise above the associated impurity requirement. Also, you see our dissolution does not change dramatically over that period. At 1 minute, it's 15%, 19, and 13%, and 100, 102, and 101. So we're not having we're not undergoing major changes. In other words, it's stable at accelerated conditions. Here is a formula, an example of how you could use it. You see the Actimask at 21.5%, our Pharma Burst 500 orally disintegrating tablet system at 73.25, flavor, sucralose, and lubrifarm, so very easy to make this tablet. It's all made by direct compression methodology. And I just wanted to show you, when you compare its release of the tablet to the actual taste mask acetaminophen, which is the blue against the red, you can see at the 1 minute time point that there's very little change on tableting, which means inside the Pharma Burst 500 system, the Actimask 92M acetaminophen can withstand the compaction without rupturing to the point that it releases the drug quickly. This is an example of a 160 milligram tablet. This is dose proportional to the 80. We just doubled the weight of the tablet from 400 to 800. And you can see that once again, 1 minute time point, no major changes in the release profile. That's the most important time point. You can see the whole profile is relatively close. The most important point is the 1 minute, because that's our exhibition of taste masking. It's our barometer, shall we say, of taste masking. And so in summary, I'd just like to say we've created taste mask acetaminophen, Actimask 92M, with an excellent taste barrier, with rapid dissolution profile, has a hydrophilic coating. You don't have to worry about any organic solvents involved in this process. You also have the benefit of the high assay, so you can make relatively large weight, or large dose tablets, I should say, and maintain the weight as low as theoretically possible. So I really appreciate your time, and I look forward to your questions. I would like to mention, if you'd like to come by and see any of these technologies, our booth is 09D43. That's correct, 09D43. And we look forward to seeing you there and talking over with you, but I will take your questions at this time. Thank you. Questions, comments? Everybody's happy? All right. Thank you so much.